Hi everyone. Just saw that the latest, the latest update on NExT has now been given to the public by the government, and I think this particular notice actually clears a lot of things, puts many things in doubts, and actually I have been going through it for a long time now, and after a complete hour of putting my time here, I've been able to take out what exactly the government means to say. I've tried to simplify it. I might have I may miss some points, so I apologize in the advance. But I think that I would be able to cover 95% of what the government is trying to say here. And don't worry, I will be there even after this video. So you can write down my WhatsApp number. I put it here. You can write down my WhatsApp number and you can text me anytime regarding any kind of confusion that you are having. So coming to the first thing, that the government is seeking comments from all the stakeholders. That means the faculties, that means the students, the people who are, eligible to give the examination, the upcoming generation, that after this proposed draft regulations, what do they think? What should be changed? How things can be made better? So this is not a confirmed draft. This is a proposed draft from the government, what they are thinking. And to be very frank, there are two things which I do not understand in this country. Number one, why do they put out everything late at night? Okay, that creates confusion all around. I mean, I got more than 1,000 messages where students are panicking and they are right at their part. Okay, we are too close to 2023 now. In a couple of days, it's going to be a new year and they are planning to maybe, put this out in the next year itself. So the panic is about to happen. And the second, why are we doing everything at such a last minute? 2023 and we have a new exam. Let's see how it goes. So if you are, after reading this proposal, if you want to submit some of your own suggestions, you can very well go ahead and do it at comments.regulations@nmc.org.in. Put it in a draft MS Word format and basically, I'm sure that there are literally very good people around. So please do put your comments here. I will be also sending some of mine. Let's see what happens. Now, in the initial thing, it's all about, government words and everything. Our main thing starts here. You can see very well here, the national exit test shall be in the form basis of. What is NExT supposed to do? NExT is supposed to give you two things. Number one, the score of NExT 1 basically is going to give you your PG seat, the eligibility to start internship and your provisional degree. That respected DR dot in front of your name so that you can start your internship. That both is supposed to be given by the national exit test. And of course, after actually you pass both the steps, you will be called a permanent licensee of India. National exit test, the NExT shall be applicable to all undergraduate medical students pursuing the degree of MBBS in all medical colleges. All FMGs as well. Please note that FMGs will also be giving NExT only. I know that's not a new news, but this is basically a confirmation that yes, FMGs have to give the NExT only. Any other person with a medical degree for a purpose such as pursuing a medical course, academic course, observership or any other purpose may be specified and approved by NMC through due notifications from time to time. Alright, the Commission shall specify from time to time by appropriate regulations or notifications the applicable manner of utilizing the result of the NExT for purpose of admission to postgraduate in broad medical specialties. Now coming to the main point, whether NEET is going to end or not. So the government has proposed this thing. It is implied that whenever NExT is in force, the corresponding equivalent existing examination shall be phased out or cease to be applicable. So they have clearly stated in, very subtle words that NEET will cease to exist or will be phased out. But they have added one more point here, which is of course my question to the government. However, if for previous batches the existing examination are applicable, as may be decided by the Commission, central government, state government, university, applicable laws and rulings, then the existing examination shall continue for such time or may be appropriate with the understanding that NExT shall be eventually replace the corresponding equivalent existing examination. Now this puts everything in the open. are they going to cancel out NEET, and or they are basically they are going to run NEET and NExT parallelly? This particular line opens everything up. But they have given in a clarity that agar NExT hota hai, if NExT happens, NEET will be phased out. In the second line, they say that if the commission thinks that the previous batches are going to suffer because of the new exam, they can be continued as NEET only. So what I believe is that in 2021 batch, please note this down, 2021 batch, they have already announced in their draft curriculum that NExT is going to happen for them. So 21 and 22 batches are going to have NExT only confirmed. But till 2020 batch, MBBS 2020 batch, they may be having NEET. Okay, they may be having NEET. But this is basically a question that I'm going to ask the government from your side, that what do they mean by this particular line? Are they going to run NEET and NExT parallelly, or are they going to cancel out NEET and it will be NExT only? The question remains. Okay, the use of score and normalization of different examinations and NExT when applicable concurrently for such purpose may be appropriate shall be determined as when the necessary and notified by the commission. Basically, if there are NEET and NExT parallelly, how they are going to have a normalization of score in both the examinations, how they are going to judge the students who are giving NEET, how they are going to give the students who are giving NExT, and how they are going to decide who is going to have the seat in which particular college. So that normalization will be decided by the commission. Okay, coming to the broad outline for the national exit test. The next step 1, there are going to be 2 steps, please note down. Next one before internship, next 2 after internship. What they have basically given a clarity on in this whole scenario is that how they are going to basically calculate the score for NExT, how they are going to calculate the score for NExT 2. There is no score in NExT 2, I'm so sorry. How they are basically going to conduct the whole examination of NExT step 2. Right, till today we had a very good impression. We knew that how next step 1 is going to happen. It was nothing new. You know, there was the whole 120 question and 60 question part. I've been telling this like for many sessions now. Now they have given us a particular clarity that how these exams are going to happen. Next step 1 shall be a theoretical exam. Questions shall be one or more than one type of multiple MCQs. Computer based hoga, nothing new. There shall be a centralized common all India examination committee who will conduct this examination. The examination shall consist of 6 papers covering subjects of 3rd and final MBBS, both part 1 and 2. So basically we have medicine and allied disciplines, surgery, obs and gynae, pediatrics, ENT, ophthalmology. Applied aspects of all subjects covered under 1st and 2nd MBBS, basically basic sciences, and applied aspects of all subjects covered under 3rd and final MBBS part 1, basically ENT, ophtha, PSM. All the subjects, all those students who have completed the 3rd MBBS and final MBBS course from a medical college recognized by commission shall be eligible to appear in this examination. There shall be regular next step 1, which will be held once a year prior to the university practical examination. Step 1 will happen, then the university practical examination will happen. All right. After that your internship will happen. If you fail in the regular step 1, then you shall be given a chance to give the supplementary next step 1. This is again a clarification point that the government has given. All right. That supplementary you have to give if you have failed in one or more subjects. Obvious. Let's suppose you do not pass both the step 1 and regular or supplementary examination, then you shall be allowed to give the examination again after an year. All right. You can see this is written clearly here. There is no restriction in the number of attempts to appear in next step 1, provided the candidate has passed both step 1 and step 2 examination within 10 years of joining the MBBS course. So basically what they are saying is number of attempts is not a problem, but the candidate has passed both step 1 and step 2 within 10 years of joining the MBBS course. Alright. So basically step 1 clear करने के लिए आपको 4 साल का मौका मिल रहा है. 5.5 साल की MBBS, then 4.5 years आपको और टाइम दे रहे हैं वो लोग. There is no restriction हो गया. I'm sorry. The next step 1 shall replace the conventional university institutional theory examination. So basically a final prof is being replaced by the next, and it will be followed by your university practical examinations. So both your third year and your final year are going to have university practical examinations. The practical examinations are not being replaced. Now coming to the step 2. Now step 2 is, although they have clarified a lot of things, but a little bit of ambiguity is still there. Now next step 2 is not going to be an MCQ examination. It is going to be a proper clinical practical viva voce examination covering 7 clinical subjects and disciplines. Please note the disciplines: medicine, allied disciplines, surgery and allied disciplines, obs and gynae, pediatrics, ENT, ophtha, orthopedics and physical medicine and rehabilitation. Alright, these are the 7 subjects, 7 disciplines in which you are going to be clinically evaluated. Now comes the part. The examination shall be objectively structured, clinical case-based, simulated case patient aimed at evaluating practical clinical skills, clinical decision-making and communication skills expected at an Indian medical graduate. Basically, what you learn during the internship, the complete course of internship is going to be evaluated in this particular examination. Alright, so no more skipping the internship now. The examination shall be held in person, live hoga, face-to-face hoga, shall be conducted by the respective state health university institutions following the standards and guidelines provided by the commission. Where state health university, now here comes the problem, here comes the biggest problem. Where state health university do not exist, the commission shall decide on university institution authorized to conduct next step 2 for respective colleges. Now the problem is that this is the biggest ambiguity part. You cannot divide the country into 2 things. One is where you are being judged by the government. The second is where you are being judged by the own university. This, which I believe is an incorrect thing by the government. If the next step 2 is being held, then the main evaluator should be government-based commissions only, and the university should play no part here, because this is where the dirty dirt happens. Alright, this is where that, what do I call, indiscipline happens. There should be a central commission, there should be a central body who is governing the whole exam, and that is how we can maintain the fairness in the evaluation, in the results. Alright, then there shall be a regular next step 2 examination once a year, and if you fail in that examination, you shall be given a chance to give the supplementary exam. Let's suppose you fail that as well. Then my friend, you have to appear after a year. Next step 2 is going to be a simple pass and fail examination. There is not going to be any score in this exam. Score will be there. It is simply going to be a simply pass and fail examination. Alright, again there is no restriction to the number of attempts, provided you pass both next step 1 and step 2 within 10 years of joining your MBBS course. Now next course, nature of score. The marks in next step 1 shall be calculated as whole number, which serve as the raw scores with appropriate decimals and subsequent corresponding percentages, marks out of maximum of 100. Alright, so the raw score is what you are scoring, number of corrects into that minus negatives. Alright, and then of course that will be considered as your raw score. Next 2 examination results shall be declared as only pass and fail based on acquisition of appropriate competencies which is being evaluated. Now this is much more subjective. And they should basically give out something of how the evaluation is going to take place. Minimum score for passing. The minimum marks for passing shall be 50%, 50 out of 100, or half of the maximum possible raw for the next step 1. For the next step 1, in each of the 6 papers, a minimum of 50% or half of the maximum possible raw score should be scored to pass the examination. Alright, should be scored. So basically they are not going to count your cumulative score. They are going to count your cumulative score, but if you have to be considered passed in all the disciplines, you need to pass individually in all of them. Okay, the criteria for passing next step 2 shall be satisfactory demonstration having acquired the competencies that are evaluated, that shall be declared as pass and fail result. Again, at such a high level, I would say that too much subjectiveness is given to this examination. Calculation of next step 1 score for determining merit for the purpose of admission to postgraduate course. The total marks, this is basically how you will get your PG seat. So how they are going to calculate the next 1 scores to decide which seat you are getting in which college. The total marks for the purpose of determining merit, especially for admission to broad specialty, shall be calculated from the sum of raw score obtained in each paper and subject. आपका जो score आ रहा है, basically your raw score that you are getting in each subject, they are going to be summed up, and that cumulative score is going to be considered for the PG seat. Normal, basic है. In case of failure for one subject, this is important. In case of failure in one or more subject, the total marks percentage of next step 1 for a candidate shall be calculated from the sum of total raw score in each subject paper obtained in both regular and supplementary examination in which the candidate has scored pass marks. So basically, even if you fail, you do good in supplementary, so your score from the main examination will be substituted by the supplementary exam, and that particular score shall be counted in your main seat. So this is basically good for people. Let's suppose that if you're not having a good day, you fail today in medicine, but you do really good in the supplementary medicine, so that medicine score will actually substitute your main medicine score. So it is again giving a fairness to the particular field. For the purpose of determining the total marks percentage of those candidates who appeared in next step 1 examination to improve their score shall be calculated from the average mean of last 3 consecutive scores. So basically, your last 3 consecutive scores are going to be considered in together, and the average, the mean, shall be taken for the total marks percentage of those candidates. Okay. Yes. For the purpose of determining this is important. Let's suppose that you give the next step examination, and after that you want to simply work as an MBBS, USMLE or IAS. Then your score shall remain with you for the next 3 years. This is one particular thing I've been telling in all my sessions. That score is not being given to the extreme of calling it a lock-in score, but that score shall remain with you. It's simply like USMLE. That score shall remain with you, and you can produce that score in any subsequent counseling, and they will gladly give you the seat available at that score. Okay, so you can see this is going to happen like this. Okay, now utility of next score. Next के score से आपको क्या क्या हो सकता है? So eligibility for provisional registration. A medical student from a college recognized by commission for imparting undergraduate medical education shall be eligible for compulsory rotating internship, provided all the following criteria are met. Basically, if you want to start your internship, you have to first pass next step 1. If you have passed in all the next step 1s, only then you can start the internship. Second, you have to pass in the practical examinations as well. Let's suppose you have done your medical graduation from overseas. Then you come back, you again have to pass next step 1. Okay, you have to again pass next step 1. You do not have to pass clinical practical again. You simply, if you are an FMG, you simply have to pass only the theory next step 1 examination. You do not have to appear in the practical and clinical world again. You can see that you do not have to appear in practicals again. Let's suppose you are a medical graduate who has qualified in India for overseas. Okay, and you are now, you want to be eligible for Indian medical registrar or state medical registrar and license to practice modern medicine of medicine. Too much, big words. For that, for those people, okay, if you have qualified for outside people, so for those, you need to have completed the duration of internship in India. You need to have passed the step 2 examination and any other new requirement considered appropriate by the commission. So, if you are going outside, if you are basically you have qualified for somewhere outside and you still want to be considered as an Indian medical graduate and you want to have your name in the Indian medical register, you need to make sure you have qualified, you have done your internship here, you need to make sure you have qualified next step 2. So basically this is for USMLE PLAB people. Okay, so if you are, I'll just write it down. So even if you want to do USMLE, even if you want to do PLAB or maybe go to Australia, anywhere, you need to make sure that you have completed the internship and you have basically qualified next step 2. Only then you shall be able to go outside and still have your name as an Indian medical doctor here. Now fourth, eligibility for admissions to postgraduate medical courses. Now please note this, if you want to be eligible for postgraduate ठीक है. Common counselling, there will be a common counselling which will be designated by authorities approved by commission, normal. Only the actual raw marks or marks percentages will be utilized to give you, to evaluate you which postgraduate seat you shall be getting in which particular college. So the next step 1 raw score is the only thing that matters right now, not the practical examination as per given here, not the practical examination, neither next step 2, only next step 1 score shall be there. Utilization of next scores for purpose other than above. So iske andar bhi, if you have a good score, that score shall be considered when you are going to give a job interview for scholarship or fellowship or any other thing that the government deems fit. Okay, so even for job, your next step 1 raw score is going to matter a lot now. Now, information regarding next step 1. So next step 1 is going to be simple MCQ examination. What a little bit of changes they have done is, in the initial draft, they had a different percentages in the question pattern. That particular question pattern has changed a little bit up down. Okay, so next step 1 is basically designed to be at par with USMLE. Let's be very fair here. Okay, let's be frank here. They are trying to design an exam that is at par with USMLE. So what they are trying to discourage rote learning, and that's a good thought. Okay, but let's see how the execution happens. To ensure assessment of a higher domain of medical learning, the exams are going to be much more comprehensive, analytical, and clinical skill problem level. So it's going to be a very tough exam, that's for sure. Now, case vignettes, clinical case scenarios shall be of overwhelming pattern of examination. We have problem solving, which is 65% now, comprehension type 25% now, recall type 10% now. Now, problem solving in the earlier draft was 60% and comprehension type was 30%. Now, that particular percentage has now been increased on the top. It is 65% and 25% for comprehension type. The level of knowledge related to the acquisition of competencies shall be approximately must know 60%, nice to know 30%, may know 10%. Paper distribution gives a clarity, although we had pretty much good clarity that the paper is going to be what? It is going to be a 6-part examination, 3 days, 2 sessions per day. We had 2 columns. One was medicine and allied subjects. That was 120 questions, 3 hours. Then followed by pediatrics. Second day we had surgery and allied subjects, followed by ENT, and third day we had obs and gynae, followed by ophthalmology. This was a 6-part examination. There was no clarity on forensic medicine. That clarity has now been given. You can see applied aspects of all subjects, including FMT and community medicine, shall be mainstreamed into relevant clinical subjects. Okay, they are going to be integrated questions with FMT and PSM as a part of their question pattern. In each subject, 10% items will be related to applied aspects of basic sciences. That is first and second year subjects plus community medicine and FMT. Okay, the following table provides a subject in each paper with respective weightage in items and time allocated with provision 20% of items. इतना लीगल कॉन्ट्रैक्ट बनाया ना, इतना हेवी लीगल बना रखा है कि पढ़ते पढ़ते मैं थक गया हूँ. बट द फॉलोइंग टेबल प्रोवाइड्स यू दिस थिंग. ये मैंने आपको ऑलरेडी बता दिया है. आई ऑलरेडी टोल्ड यू द 3 बिग सब्जेक्ट्स मेडिसिन, सर्जरी, ऑब्स एंड गायनी आर गोइंग टू हैव 120 क्वेश्चंस in 3 hours, and the short subjects here, peds, ENT and ophthalmology, are going to have 60 questions in 1.5 hours. The proposed timeline is like this. You are going to have a break of 2 hours between the 2 sessions, and you can see the number of questions and the number of hours here. Now, step 2. Step 2 is again a little bit on the subjective side. When I say subjective, I mean we do not have an objective view of evaluation here. The next step 2 shall be comprehensive practical based. We know that. It will be done after internship and evaluated competencies in clinical diagnosis, patient and clinical decision making, and practical and communication skills necessary for practice in India. Evaluation methods are going to include what? Actual cases, OSCE, simulations if possible. I don't think so simulations will be possible in most part of the country, but let's see what happens. Okay, you are going to be competent or pass, or not competent or fail. The distribution of subjects are going to be as follows. I have already told you: medicine, surgery, obs and gynae, peds, ENT, optha, orthopedics and PMR. Now time schedule is not given by the authorities, and they are actually written that time schedules and modalities of next step 2 shall be decided by the NMC later. The time schedule for the entire process of next examination, internship and admission to broad specialty PG courses shall be announced by the commission. This is basically a draft proposal from the government. First, after clearing your pre-prof, okay, your final pre-prof, you will be having your next step on regular, which they are planned to announce in second week of December. Date will be coming in second week of January. Then after that, we will be having next step supplementary. How long it will happen, which I believe should be basically third or fourth week of December, क्योंकि उसके हिसाब से बनता है. Okay, then we have the third and final MBBS Part 2 Practical and Clinical University Examination, first week of January. Then starts the internship, 1st February. Next step 2 regular will be occurring in second week of March. Then we have the next step 2. Again, should be in basically maximum in April. Postgraduate admission starts in May and June. Postgraduate course will start on 1st of July. I believe that's a very ambitious and expedited timeline, which I do not believe is going to happen. We have seen the last 3 counselings happening. Are you thinking that the whole counselling can occur in 1 month? I will say that is too ambitious. So I guess with this we come to the end of the latest draft proposal by the National Medical Commission. If you have your suggestions, you can very well WhatsApp me, you can connect with me on Instagram, or you can send it directly to the government. Please do so. I love being in a democracy, because at least the government is giving us a chance to put out a voice here. So please go ahead, give your valuable suggestions, and I believe together we are going to make this exam as better for the students as possible. Thank you so much. I hope you don't mind the long video, but again, thank you and best of luck.